Welcome back, everybody, to another Medvarsity Deep Dive. Today, we're going to be tackling something pretty interesting, I think, and that's antibiotics after surgery.
Yeah, it's one of those things that you don't always think about, right? You have surgery, you might get antibiotics, but there's actually a lot more to it.
Right? Yeah, there's like a whole bunch of different factors to think about. I mean, obviously the science behind it, whether or not you actually need them. But then, you start thinking about cost for patients and then even just like the ethics behind it all. Like, is it right to be giving antibiotics if they're not really needed?
Absolutely. And sometimes it's really crucial. Like if there's a true infection, antibiotics can really be a lifesaver, but in other cases, it might be adding, a cost burden to the patient and maybe not that much benefit.
Yeah, that makes sense. And it's funny because just the other day I was looking at some stats and I saw this one that said that like 2.2% of Indian ICU patients, they actually fall below the poverty line because of just one admission. And I was like, wow, that's crazy.
Yeah.
Especially when you think about how expensive some of these antibiotics can be.
Yeah, absolutely. And that really ties into this whole problem of overuse.
Yeah, for
But
sure. And I remember in our source material that they mentioned impaction, so like, wisdom teeth coming out as one example where maybe antibiotics are being overused.
yeah.
Is that something that you've seen in your experience?
Yeah, it's really interesting because if the surgeon maintains a really sterile environment and makes sure there's proper drainage, the risk of infection is much lower. And so in those cases, maybe antibiotics aren't even needed.
So you're saying that like good surgical technique can sometimes replace the need for antibiotics.
Absolutely.
Wow, that's pretty amazing. I
Hmm.
feel like we don't always think about that. So then what about the cases where antibiotics are given before surgery? I think I've heard that called like prophylactic use or something.
Yeah, so that is a common practice, and it's often done to prevent potential infections. Kind of like how you wouldn't go into battle without wearing any armor.
Right.
In some surgeries, that armor is a dose of antibiotics.
That makes sense. So when would that be done? What kind of surgeries are we talking about?
Well, a good example is coronary artery bypass surgery. It's a major procedure and you really want to prevent infection. And studies have shown that something as simple as giving the patient a chlorhexidine bath the day before can really reduce the risk of infection after surgery.
Wait, so just a bath can make that much of a difference?
Yeah, it can really help.
Wow, that's incredible. So it sounds like there are a lot of really interesting ways to target antibiotics and use them more effectively.
Absolutely. There's a lot of exciting research going on right now. For example, there's something called the procalcitonin test, and it can help doctors figure out if a patient's at risk of developing sepsis, which is a really serious complication of infection. And then there's the whole world of genetic testing, which is amazing.
Hold on, genetic testing for infections. Tell me more about that.
Yeah, so with genetic testing, we can actually figure out the exact bacteria that's causing the infection. And that means that we can choose the blood antibiotic to target that specific bacteria. And that makes treatment a lot more precise.
So it's kind of like personalized medicine, but for antibiotics.
Yeah, exactly.
That's incredible. But even with all of these advancements, I still worry about overprescription. I feel like it's just such a common habit in medicine.
Yeah, it's a valid concern, and that's why it's so important to go back to the basics. A good doctor will always do a careful exam and really think critically about the situation. Before jumping to antibiotics, we need to ask, does this patient actually have an infection that needs them?
Right, so not just assuming that any kind of inflammation means it's an infection.
Exactly. And sometimes bacteria might be present, but they're not actually causing any harm. And we call that colonization. And it might not be necessary to treat that with antibiotics.
Well, that's interesting. So it's not just seeing bacteria and giving antibiotics. It's about figuring out if they're actually causing a problem or just kind of hanging out.
Exactly. And even in cases where patients have conditions that make them more prone to recurring infections, like, for example, bronchiectasis.
Bronchiectasis, I'm not sure I've heard of that one.
So imagine a tree and the branches have become damaged and widened. And now picture those branches as the airways in your lungs. So in bronchiectasis, the airways are damaged, and that makes it easier for bacteria to get trapped and cause
Oh,
infections.
so it's like the lungs are more vulnerable?
Exactly.
That sounds really tough.
It can be, but even in these cases, you have to be really careful about using antibiotics. We still need to figure out if it's a true infection or just colonization. And even when antibiotics are needed, there are more targeted approaches. like using nebulized antibiotics, which deliver the medication directly to the lungs.
So it's like a direct hit to the source of the problem.
Exactly. And that brings us back to some of the things we were talking about earlier, like topical antibiotics and bacteriophages.
Oh yeah, tell me more about those. They sound so futuristic.
Well, topical antibiotics are applied directly to the infection, so you can think of things like antibiotic creams or ointments. And by targeting the infection directly, you can reduce the chance of side effects in other parts of the body.
That makes a lot of sense. What about those bacteriophages?
So bacteriophages are actually viruses that can kill specific bacteria. You can think of them like tiny assassins programmed to seek out and destroy harmful bacteria. And they have the potential to totally change how we treat infections, especially with antibiotic resistance becoming such a big problem.
Wow, so we're using viruses to fight bacteria. That's pretty wild.
It is.
It sounds like the future of infection control is looking pretty bright.
Yeah, there's a lot of reason to be optimistic, but even with all these new developments, we have to remember the core message. Rational antibiotic use. It's a shared responsibility, and we have to find the right balance between treating infections effectively and avoiding unnecessary prescriptions.
Because there are consequences to overusing them.
Absolutely, not just for the individual patient who might have side effects or develop resistant infections, but for the whole of public health.
Wow, that makes you think, what can we as individuals do to be more responsible about how we use antibiotics? Can we actually make a difference?
Of course you can. It starts with being informed and asking questions. Don't be afraid to talk to your doctor about whether antibiotics are really necessary for your situation.
So it's about being an active participant in our own healthcare,
Yeah.
not just accepting whatever prescriptions are given to us.
Exactly. Understanding why you're being given a treatment can really empower you. And sometimes the most important question you can ask is a simple one. Are antibiotics really necessary in this case?
It sounds like that conversation, that open dialogue between doctor and patient is so important for making sure that antibiotics are used responsibly.
It really is. It's a partnership. And it's not just about individual decisions. Think about the bigger picture.
Bring it home for us. What does that bigger picture look like?
Imagine a world where antibiotics don't work anymore. The infections that are easy to treat today could become deadly again. Surgeries, even routine ones, could become much riskier. That's what could happen if we overuse antibiotics.
That's a scary thought. It really shows how important this issue is. It's not just about today's prescription. It's about making sure that these life-saving medications are still available in the future.
Exactly. And it's a future that we can all help shape by being informed, asking questions, and standing up for ourselves and our loved ones.
This has been a really eye-opening deep dive. I feel like I've learned so much, not just about the science behind antibiotics,
Yeah.
but about how important critical thinking and open communication are in healthcare.
I'm glad to hear that knowledge is power. And the more we understand about this issue, the better choices we can make.
Thank you for joining us today on Medvarsity Deep Dive. We hope this conversation is giving you the information you need to be more informed and proactive about your healthcare. Until next time, stay curious.
Yeah, it's really amazing. It's like we can look at the DNA of the bacteria and really see what's going on,
Wow.
and then choose the perfect weapon to fight it.
It's really incredible. But, I have to say, even with all this amazing technology, I still get worried about, doctors overprescribing antibiotics.
Oh, absolutely. That's why, even with all the tests and new treatments, it always comes back to the doctor.
Yeah.
They have to look at the patient really carefully, ask the right questions, and think critically before they just jump to antibiotics.
Yeah, makes sense.
Like you said before, just because there's inflammation doesn't mean it's a true infection.
Right.
Sometimes the bacteria are just there, but they're not actually causing any harm. And we call that colonization.
Colonization.
Yeah, and in those cases, giving antibiotics might not help at all.
So it's really about understanding, is it an infection or is it just some bacteria hanging out?
Exactly. And even in cases where patients have conditions that make them more likely to get infections, like bronchiectasis.
Bronchiectasis.
Yeah, it's not a word you hear every day.
What is that?
So basically, it's a condition where the airways and the lungs are damaged. Imagine like a tree with branches that have become all twisted and whitened.
No.
And because of that damage, it's easier for bacteria to get trapped in there and cause infections.
So the lungs are more vulnerable in a way.
Right.
That sounds really difficult to deal with.
It can be challenging, for sure. But even in these cases, we have to be careful with antibiotics. We still need to figure out, is it a real infection or just some bacteria that are there but not causing a problem? Right.
And even when we do need antibiotics, there are ways to target them more effectively, like we were talking about before with topical antibiotics. Or have you heard of nebulized antibiotics?
Nebulized.
Yeah, so it's basically a way to deliver the antibiotics directly to the lungs.
Oh, wow. So it's like a direct hit to the infection.
Exactly. And that can be really helppful for people with bronchiectasis.
Makes sense.
And that reminds me, we were talking about some of those really exciting new treatments.
Oh, yeah, like those bacteriophages. It still blows my mind that we're using viruses to fight bacteria.
I know, it's pretty amazing,
Oh,
right?
that's like science fiction.
Yeah, well, the future is now, I guess. And with these new tools, we have a real chance to stay ahead of the antibiotic resistance problem.
That's great to hear because it really feels like a race against time sometimes.
It is, but it's a race we can win if we work together.
What do you mean by that?
I mean, it's not just about scientists developing new treatments. It's about all of us using antibiotics responsibly.
Because like we've been talking about, overuse has consequences.
Yeah, for sure. I mean, we talked about the cost for patients,
Yeah.
but I guess there's also the risk of, developing antibiotic resistance.
Exactly. And that's a problem for everyone, not just the individual patient.
So what can we do about it? Like, what can we do as individuals to be more responsible?
Well, first of all, be informed. Learn about antibiotics, how they work when they're needed, when they're not.
Right.
And don't be afraid to ask your doctor questions.
Like, what kind of questions?
Well, is this antibiotic really necessary? Are there any other options? What are the potential side effects?
So it's about being proactive and really understanding our own healthcare.
Exactly. Knowledge is power. And when it comes to antibiotics, the more you know, the better choices you can make for yourself and for everyone else.
So it's about, taking control of our own health and not just blindly following whatever the doctor says.
Absolutely. And sometimes the simplest question is the best one. Like, are antibiotics really necessary in this case?
Right. So it seems like, having that open conversation with your doctor is really important.
It is. Yeah, it's like a partnership.
Uh-huh.
And it's not just about what we do as individuals either. It's bigger than that.
Okay. So what's the big picture here?
Well, imagine a world where antibiotics just don't work anymore.
Oh, wow.
The infections that are easy to treat today could become life-threatening. Surgeries would become much riskier.
Oh, gosh.
Yeah.
That's a scary thought.
It is, and that's what we're facing if we don't use antibiotics responsibly.
It's not just about today's prescription. It's about making sure these medicines are still around for future generations.
Exactly, and it's a future that we can all help create by being informed and asking questions and speaking up for ourselves.
Wow. This has been a really thought-provoking deep dive. I feel like I've learned so much, not just about, the science behind antibiotics, but also about how important it is to think critically and communicate openly with our doctors.
I'm glad you found it helpful. The more we all understand about this issue, the better decisions we can make.
Well, thank you so much for joining us today on Medvarsity Deep Dive. We hope this conversation has helped you to be a more informed and proactive advocate for your own health. Until next time, stay curious.